Okay, so we're gonna do knee flexors, knee extensors with Kristen. First thing we're gonna do from a cam side I would look, have her flex actively to 90, fully extend your hip. Good, back down. Then we'd also look at full flexion, down, good. Same thing, internally rotate, pull down, excellent. Externally rotate, pull down, good. With the cams, we would obviously do both sides to test for range of motion restrictions that are then going to guide us through our different tests and fixes. So we're going to start with semimembranosus. So for semimembranosis, I'm going to have Kristen actively flex. She is going to internally rotate her hip. She's going to internally rotate her tibia. We're going to flex or drop down to 75 degrees. She's going to flex her knee down to 70 degrees and now let me pull up. Excellent. Have you lay on your stomach. We're going to deformat that. I'm going to do the other side just for video's sake. Started it. We're going to be on ischial tuberosity, just posterior and lateral. A midline here. Good. And we're going to follow that down here to medial, the medial condyle of the tibia. Kind of follow that muscle. We're going to drop right in there. Good. And for her picks, lay back on your back. We take her into that same position. We're going to go to 90 degrees. I'm going to have her fully internally rotate. We're going to drop down to 70, and I'm going to have you push gently into my hand, Kristen. 10%, 6 times, 6-second holds. Good, and relax, making sure we maintain that hip internal rotation, that tibial internal rotation. Okay. So for semi-tendinosis, we're going to be very similar. We're going to take her up to 90. We're going to drop to 75. I'm going to have her fully internally rotate. She's going to fully internally rotate. And we're going to flex to 110 degrees. Don't let me pull. Good. To deformat, lay on your stomach. Same thing. We're going to be ischial tuberosity. This lower part. And then hold right here. I'm going to find that tendon. We're going to follow that around to that pes group and be right on that medial condyle of the pes anserine. Good. Lay back on your back. So picks, same thing, bring her up. We're going to fully internally rotate. We're going to fully internally rotate the tibia. She's going to actively flex to 110 degrees. I'm going to have her push it at 10% force down into my hand. Good. And we're going to hold 6 times, 6-second holds. Okay. Biceps femoris, we're going to do the long head first. So for this, we're going to do a little bit different, more external rotation. I'm going to have her flex. She's going to externally rotate her hip. She's going to externally rotate her tibia. We're going to flex down to 70 degrees. And don't let me pull. Excellent. Lay on your stomach. We're going to hit that posterior lateral ischial tuberosity for the deformat. And then we're going to be posterior to that lateral head of the fibula. Good. Lay back on your back. Do her picks, same position. We're going to fully externally rotate. We're going to fully externally rotate. Flex to 70. Don't let me pull. Hold, hold, hold. 10% hold. 10 times. For the short head, we're going to be same position. We're going to drop down to 75. She's going to fully externally rotate. She's going to fully externally rotate. We're going to drop down to 110 degrees. Don't let me pull. Good. A little weak. Lay on your stomach. Bring the at the wrong side again, but we're going to drop into that posterior lateral shaft of the femur. Good, and then into that lateral, posterior lateral fibular head again. We're going to kind of reach around to try to get that superior half as well. Good, lay back on your back. Knee extensors, vastus medialis. So for this one, she is going to be up at 90-90. We're going to drop her heel to the level of that other knee. She's going to plantar flex. She's going to internally rotate the tibia. She's going to externally rotate the hip. And again, this is vastus medialis, so I'm going to push her into that internal rotation. Good. Flip on, or actually stay right here. We're going to hit on the linea aspera, since we're doing this was the upper fibers, so we're going to hit upper third, vastus medialis. Kind of dropping in, I can feel rectus, VMO. So we're just dropping right in there off of that. Good. And then we're going to come down here to medial patella. And to that tibial tubercle. Good. Middle fibers, we'll do our picks first for this. So she's going to flex, she's going to plantar flex, internally rotate the tibia, externally rotate the hip. We're going to drop her to the level of that other knee, push into my hand gently, hold, 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 and relax. 6 times 6-second holds. For the middle fibers, same position. She's going to be externally rotated. She's going to be internally rotated. At the tibia, we're going to drop down to mid-tibial shaft. Same thing, hold. Good. And for the purpose of this, we're going to do her lower fibers before we do her picks. Same thing, make sure she's externally rotated with the hip. Actively bring that out as far as you can. Good. Actively internally rotate your tibia. Good. Don't let me push. Excellent. To deformat for the middle fibers, just on that middle third of the linea aspera. Drop down off of patella, medial part, and tibial tubercle. And for the lower, same thing. Drop into that lower third of linea aspera. Patella. Lower part. If we were going to do our picks with those, we would set her up. She would plantar flex, fully externally. Plantar flex. Fully externally rotate her hip. Fully internally rotate. Drop down to that mid shaft for middle fibers. Hold, hold, hold. 6 of 6. Same position for the lower fibers. Hold, hold, hold. 6 of 6. Vastus lateralis upper fibers. We're going to be 90 degrees. She is going to plantar flex. She is going to internally rotate her hip, externally rotate her tibia. I'm actually going to be on this side, so it's going to be hard to see. We're going to come down to midline of the knee with her malleolus. She's going to maintain that full hip internal rotation, that plantar flexion. External rotation of the tibia. Don't let me pull. Good. And I'm pulling her into internal rotation. She's resisting that external rotation. We would do the same positioning for the middle fibers. She would be full internal rotation. She'd be plantar flex. She'd be full external of the tibia. For the middle fibers, we'd be mid shaft. That one is really weak. And for the lower lower fibers home, we would be in line with that medial malleolus. To deformat those vastus lateralis fibers, for the upper fibers, we're going to be right at that lateral border of the greater trochanter. So drop down right where they come off. And then that upper third of the linea aspera. Good. And then lateral patella. And at that lateral tibial crest on the outside of the patella tendon tibial tubercle. We do the same thing, drop in between IT band or alpha IT band for the middle fibers. Sorry, that's a tender one. Lateral patella, lateral tibial tubercle, and then those lower fibers. Good. Same spot, lateral patella, lateral tibial tubercle. For her picks, we'll just run through. She's going to be full plantar flexion. She's going to be fully internally rotated. She's going to externally rotate the tibia. We're going to drop down the level of the knee. She's going to gently pull out into my hand. Hold, 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 hold. 6 times 6 second holds. We would do the same thing for middle fibers at mid shaft. Keep that full internal rotation and plantar flexion. Good. And we do the same thing. And hold for the lower fibers. Vastus intermedius. We're going to hit the lateral fibers first. She is going to fully flex her hip as far as she can, approximately 110 degrees. We're going to fully internally rotate the tibia. She's going to flex down to 110 degrees, and she is going to push up into my hand. Good. To deformat that, we're going to hit the anterior lateral surface. And drop down deep, a little more anterior than we were for vastus lateralis. We're going to hit that upper 2/3 of the femur. Good. And then we're going to hit right below the quad tendon and patella tendon. Good. And for the medial fibers, we'll do our picks first, sorry. So she's going to flex to 110 degrees. We're going to externally rotate externally rotate the tibia, flex to 110, hold, push out into my hand. Good, hold, 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 10%, 6 times 6 second holds. Good. For the medial fibers, she is going to again flex. She's going to fully internally rotate the tibia. She's going to flex her knee to 110 degrees. Push up, hold, hold, hold. Good. To deformat that, we're going to hit same area just under the rectus, that anterior surface, upper 2/3 of the femur. Good. We're going to hit right at that quad tendon insertion. We will retest, flex to 110, internally rotate, flex to 110, push up. Good. And for her deformats, relax, keep that internal rotation, push gently into my hand, 10%, 6 times 6 second holds. Good. For articularis genu, we're going to be 20 degrees hip flexion. 20 degrees knee flexion, and I'm going to have her push up into my hand, trying to flex her hip and knee at the same time. Good, and relax. And again, good, and relax. We're going to deformat at that superior patellar bursa and at that inferior part of the femur. And this guy's job is to help pull that bursa out of the way and that terminal knee extension so it doesn't get pinched. So again, we're going to flex up to 20, flex to 20, push up into my hand. Excellent. To do her picks, same thing, try not to let her internally rotate. Keep it there, gently lift, hold, hold, hold. And she's trying to extend the knee and extend the hip, flex the hip a little as well. Good, 6 times 6 second holds.